Every type of thyroid disorder explained. It's a small butterfly-shaped gland sitting at the base of your neck, and it quietly controls how fast every single cell in your body runs. Your metabolism, your heart rate, your body temperature, even how your brain processes thoughts. When it's working right, you never think about it. When it isn't, almost everything about how you feel can change. Let's go through every major way this gland can malfunction. The basic mechanism. The thyroid produces two hormones, mainly T3 and T4, and its output is controlled by a signal sent down from the brain called TSH, thyroid stimulating hormone. It's a feedback loop. When thyroid hormone runs low, the brain sends more TSH to demand more production. When thyroid hormone runs high, the brain backs off and sends less. Almost every thyroid condition on this list comes down to that loop breaking somewhere. Either the gland makes too little, too much, develops a physical abnormality, or the immune system gets involved and starts interfering with the whole system directly. Hyperthyroidism. This is an underactive thyroid, and it's the most common thyroid problem by a wide margin. The gland simply isn't producing enough hormone, which means your entire metabolism slows down. The symptoms read almost like a list of things running in slow motion. Fatigue, weight gain despite no change in diet, feeling cold constantly, dry skin, hair thinning, and a kind of mental fog that makes quick thinking noticeably harder. It develops gradually, often over years, which is exactly why so many people dismiss the early symptoms as normal aging or simply being tired. It's diagnosed with a simple blood test checking TSH and T4 levels, and it's treated with a daily synthetic hormone replacement pill, which for most people works so well that symptoms fully resolve and stay that way for life. Hashimoto's thyroiditis. This is the single most common cause of hypothyroidism in developed countries, and it's fundamentally different from simple hypothyroidism because it's autoimmune. The immune system mistakes thyroid tissue for a threat and attacks it slowly, over years, gradually destroying the gland's ability to produce hormone. In the early stages, the damage can actually cause brief episodes of excess hormone leaking out as cells are destroyed, before eventually settling into the more typical pattern of underproduction. It runs heavily in families, appears far more often in women, and is confirmed with a blood test checking for specific antibodies rather than just hormone levels alone. Treatment ends up looking identical to regular hypothyroidism, daily hormone replacement. But knowing the cause is autoimmune matters, since it means monitoring for other autoimmune conditions that often travel together with it. Hyperthyroidism. This is the opposite problem, an overactive thyroid pumping out too much hormone, which speeds the entire body up rather than slowing it down. Symptoms include a racing heart, unexplained weight loss, despite eating normally or even more than usual, anxiety, tremors, heat intolerance, and trouble sleeping. Left untreated for a long stretch, it can put serious strain on the heart. There are several different underlying causes that can lead here, which is why hyperthyroidism itself isn't really one disease. It's a symptom pattern that several distinct conditions can produce. Graves' disease. This is the most common cause of hyperthyroidism, and like Hashimoto's, it's autoimmune. Except here, the immune system doesn't destroy thyroid tissue, it accidentally stimulates it into overdrive by producing an antibody that mimics TSH and tells the gland to keep producing hormone non-stop. A distinctive feature found in a portion of Graves' patients is bulging, protruding eyes caused by inflammation and swelling behind the eyeballs themselves, a separate complication of the same underlying immune attack. It's treated with anti-thyroid medications that block hormone production, radioactive iodine that shrinks the gland, or in some cases, surgical removal of the thyroid entirely, after which patients typically move onto the same hormone replacement used for hypothyroidism. Thyroiditis. This is inflammation of the thyroid itself, and it behaves almost like a temporary storm rather than a permanent condition. Depending on the cause, a viral infection, childbirth, or in some cases certain medications, the inflamed gland often dumps its stored hormone all at once, causing a temporary period of hyperthyroid symptoms, followed weeks later by a temporary underactive phase as the gland's stores run empty before recovering, followed finally by a return to normal function in most cases. Postpartum thyroiditis specifically affects a meaningful percentage of women in the months after giving birth, and frequently goes unrecognized, since new parents already expect to feel exhausted and off, making the actual thyroid swing easy to miss. Thyroid nodules. These are lumps or growths that form within the thyroid gland itself, and they're remarkably common. A large percentage of adults have at least one by the time they reach older age, most of which are completely silent and never cause a single symptom. The overwhelming majority are benign and don't affect hormone production at all. A smaller number produce hormone independently, causing hyperthyroid symptoms, even though the rest of the gland is functioning normally. And a small minority turn out to be cancerous, which is why any nodule that's discovered, usually incidentally during an unrelated scan or physical exam, typically gets evaluated with an ultrasound and sometimes a needle biopsy just to rule out that smaller possibility. Goiter. This simply means the thyroid gland has become physically enlarged, visible as swelling at the base of the neck, and it isn't a specific disease on its own. It's a physical sign that can accompany almost any of the conditions already listed, from Hashimoto's to Graves' to simple iodine deficiency. Historically, goiter was overwhelmingly caused by insufficient dietary iodine, since the thyroid needs iodine to make hormone at all and will physically enlarge, trying to compensate for the shortage. In countries with iodized salt, this specific cause has become rare, though goiter from other underlying thyroid conditions remains common worldwide. Thyroid cancer. This is one of the more survivable cancers when caught early, and it typically shows up as a lump that's discovered incidentally, rather than through any dramatic symptom, since early thyroid cancer usually doesn't cause pain or hormonal changes at all. There are several distinct subtypes, and they vary enormously in behavior. Some grow so slowly that doctors sometimes choose careful monitoring over immediate treatment, while a couple of rarer, more aggressive subtypes require immediate intervention. Treatment usually involves surgical removal of part or all of the gland, sometimes followed by radioactive iodine to eliminate any remaining thyroid tissue, after which patients go on lifelong hormone replacement, since a thyroid that's been removed obviously can't produce anything anymore. Congenital hypothyroidism. This is a thyroid disorder some babies are simply born with, either because the gland didn't develop properly in the womb or because of a genetic issue affecting hormone production from birth. It's serious enough that most developed countries now screen every newborn for it automatically within days of birth, because untreated congenital hypothyroidism in early infancy can cause permanent developmental and cognitive delays. Caught early through that routine screening and treated immediately with hormone replacement, affected children develop entirely normally, which makes this one of the clearer success stories in newborn medicine. The bottom line: one small gland, one feedback loop, and an entire list of ways that loop can break. Autoimmune attacks in two opposite directions, physical growths, temporary inflammation, genetic causes present from birth, and even a version where the gland is innocent, and something else entirely is to blame. Knowing exactly which one you're dealing with is the difference between a daily pill that fixes everything and missing something that needed a completely different kind of attention. If this helped you finally make sense of your thyroid, do me a favor. Hit like, share it with someone who needs to hear it, and subscribe for more videos like this one. See you in the next video.